I'm Sharon, I'm 59. I'm a paramedic team leader for Welsh Ambulance Services. Everybody knows something about corona. You know, it's a con, it's this, it's that. It doesn't exist. It does exist. It exists and pervades mine and my colleagues' lives, and has done for almost a year. It is terrifying. This could kill me. Only last week we lost our second member of staff to this cruel, indiscriminate virus. A man in his early 60s, a man who's given his life to public service, a fireman before he even joined the ambulance service. My heart is breaking for his wife and his family and my colleagues who worked with him closely. But also for us as a service, it's a knife through all our hearts. This brings home how indiscriminate and deadly this virus is. We're referred to as heroes. Every hero has that nemesis. It makes for the story. This is our nemesis. This is kryptonite to us. It saps you of everything. I'm scared. I've never found it difficult to go to work. I find it difficult. I have to deep breathe before I leave the house. The numbers now equate to more than a jumbo jet of people crashing on the country every day. And yet it's, oh well. There will be lasting effects from this on us, I have no doubt of that. I don't know this virus. You don't know this virus. What we know is the effects. It's cruel, it's heartless, it's indiscriminate. And it's here. By God, it's here.
Sharon Thorpe from the Welsh Ambulance Service. Well, we're joined now by Dame Donna Kinnair. She's Chief Executive of the Royal College of Nursing. We've heard of the sheer exhaustion and stress from that paramedic in South Wales, Dame Donna. What you clearly need is more human resource. Can you get it perhaps from private sector nursing or indeed the armed forces?
I do believe that we have been utilising all of those resources. You'll remember during the first pandemic when many of the private hospitals were taken over by the NHS. So those resources are being utilised, and you can see already the armed forces has been deployed to many areas in England.
Do you feel that the authorities, the Health Secretary and the rest, understand the extent to which you're stretched? Is there anything that can be done to alleviate what's going on? I mean, do you need more volunteers?
Well, as you know, the NHS did put out a call for volunteers and always had volunteers to work with us. But actually, in some of this work, as the paramedic just talked about, you really do need the skill of nursing staff, because we are talking about looking after ventilated patients. And so it is complex work and patients that have to be monitored very closely. So it takes all the skill of trained nurses. And I guess I would say that we are in this pandemic. None of us could have seen it coming, but we do need to ensure that, anything we face, that we have adequate numbers of staff to take care of our patients going forward.
We've been to intensive care wards where nurses normally look after one patient, and they're now looking after 4. I mean, the toll must be absolutely incredible.
When I talk to nurses on a daily basis, it's not only the fact that it's 1 to 4 now. The work is draining. In normal circumstances in an ICU, wouldn't be dressed in all the PPE equipment. So you can imagine for those nurses every single day, it is heart-rending. And not only that, those nurses also face seeing their friends and other nurses succumbing to this deadly virus and having to nurse them too. So I think the toll is on the nursing profession. I think they are muddling through it. And one of the things that I know as a nurse is that in times of crisis, the NHS does know how to pull together. People, all sorts help, whether it's porters, everybody pulls together to do the best that they can to get through it. But as that paramedic just said, There's no doubting the toll that it's taken on each and every individual, and the fear that people have when they're working in these circumstances, when they don't have enough resources.
Well, now, Watford Hospital told us about a virtual COVID ward, which sounds quite promising in a way, because clearly there are people who, yes, they are at home and they may be, stable, but if they had access to a ward like that, it would also alleviate some of the pressure on you. Is this a goer?
It absolutely is a goer, but actually we should remember that some of those things are because of the circumstances. You cannot get any more people into the hospitals at this moment in time. So, of course, we're using AI or intelligence to help us to monitor people while they're in their own homes. And we have done that over some time, really. We've done that to monitor diabetic patients. It is now useful to monitor the oxygen levels of people suffering from COVID, so that actually we can get them into hospitals before any damage is done.
Now, the take-up for vaccines is over 6 million. But what do you say to those people who, for cultural or other reasons, just won't take the vaccine?
So I'm absolutely clear that we are urging everybody, whatever culture you are, to take this vaccine, because actually it is our only way out of this pandemic. So I think that we do need to encourage as many frontline practitioners, everybody, to take the vaccine. I'm constantly having conversations with people that are saying to me, I'm a bit nervous. There's huge amounts of information out there now. We know that many people are spreading disinformation about the vaccine. And I think as NHS leaders and as clinical leaders, all of us have a duty to have those conversations that this is the only way out of the vaccine, and it is life-saving for individuals.
Dame Donna Kinnair, thank you so much for joining us. Thank you.